I also want to just briefly mention the relevance of intersecting strategies, and one in particular which is cross-sectoral, early intervention. Stroke would be one of the leading causes of acquired long-term disability. I was heartened to see that Dr. Keith McPherson is part of the working group. It has proven that timely and appropriate intervention for people who suffer stroke can drastically improve their post-rehab functional capacity and ultimately their ability to participate in employment or vocational activities in their community. Application in the education sector to improve the opportunities for disabled children and young people are fairly obvious. Current steps. Just to bring us to the current context for change, the activity in the disability sector hasn't slowed down. In 2009, the Ministerial Committee on Disability Issues was established to lead the government's response following the Select Committee inquiry in 2008. That committee is chaired by the Honourable Tariana Turia and has set priorities for government agencies that are grouped under 3 themes. Those 3 themes are to modernise disability supports, and I'm heartened to see expanding the choices for individuals. Accessible New Zealand, creating accepting communities to counter discrimination and marginalisation, and thirdly, contributing citizens. In 2009, we also had a report from the Office of Disability Issues on progress against the New Zealand Disability Strategy. And I must pause here just to make brief reference to the significance of the signing of the UN and subsequent ratification by New Zealand of the UN Convention on the Rights of Persons with Disability. But back to 2009 and the progress report, which is formatted generally under those same 3 themes. I just wanted to note a couple of things briefly. There is current work underway in government departments on the sickness and invalids benefits, and these are included within the scope of the work of this welfare working group. One of my comments to the working group is to take time to reflect on the diversity of the people supported by the welfare system. Many of the people will continue to need long-term support, so any actions recommended by the working group for disabled people with long-term support needs ought to reflect ongoing leadership and a continued commitment to community inclusion. And lastly, it would be important to continue to leverage the leadership that can be afforded by the Employers' Disability Network, and in particular to assess the impact, both positive and negative, of the recession on the capacity of employers to support government direction. This aspect certainly received a boost in the budget 2010, with $3 million over the next 3 years for improving attitudes. So with all this is happening, it's important to routinely reflect on whether we're achieving the fundamental principles that we aspire to. It is also essential that all the activity remains coherent. This requires collaboration between the leadership from within government, the leadership of disabled people, and the leadership within the sector. Okay, getting to the end. I just want to reflect on a core principle for the welfare system as I close. Dignity as a core principle for the welfare system emphasises the necessary attitude to bring about community inclusion. And I've chosen to highlight it here, as I did to the Welfare Working Group when they visited Auckland, that if we're going to have a welfare system, then base it on the dignity of the individuals. Because valuing the dignity of the person means differentiating between the reason why they need support and the choices that they make. Yes, you need rules to ensure fairness and transparency, and rules to measure the fairness and transparency of the rules, but the first step to building pathways to anywhere is by developing the right relationship. Secondly, valuing the dignity of the person means having a relationship with them whereby you can work in partnership and actually understand what builds feelings of self-worth for that person. This is vital. For all of us, it's the same. Our self-worth is connected to our capacity to contribute and participate. It is not the need to receive, it is the opportunity to give that builds self-worth and dignity. Valuing the dignity of the person also means supporting them to make real choices. This puts the onus on the system and its connectivity with society and communities. If the system is a reflection of those communities, then those two forces need to work together to create the context for community inclusion. If the choices people are offered have value to their community and they draw on their individual strengths, desires, abilities and choices, then those choices will be real because they actually matter In summary, the pathway of benefits for disabled people is, in my view, first requires us to check our mindset. Some people will need long-term support. Some people will need long-term support, however. The outcomes we want for disabled people and the community and the country will be gained by continuing our journey towards being a more inclusive community. In terms of the welfare system, it's time to update its core underlying principle to reflect the dignity of all those people it supports, and in the context of my particular discussion today, the dignity of disabled people. Nā reira, tēnei te mihi atu ki a koutou katoa, tēnā koutou, kia ora tātou katoa.